All right. Seeing as the time is 6:02, I'd like to call our meeting to order. All members present with the exception of Vice Chair Alex Haggerty. So first item on our agenda is the Pledge of Allegiance. So if everyone would please virtually stand and hand over heart. I pledge allegiance to the flag of the United States of America, and to the
Republic for
for
which
which
it
it
stands,
one
one
nation,
nation, under God, indivisible,
Liberty and justice.
liberty and justice for all.
That's why we usually don't do this when we're virtual. So our first item on our agenda, I'm going to move to the end of the meeting and give our guest an opportunity to show up. So if we could start with the COVID-19 update, I'll bounce over to Marty.
So we had a few adjustments at the end of the day, but it ended up panning out to still being 18 with the same number of close contacts. So you can draw a line through all of the recent cases, and one of then that line is people not staying home when they are not feeling well. And so I please, I'm begging you, if you don't feel well, please stay home, because you're putting a lot of people at risk financially, physically, and all of those other things. So please stay home if you feel sick. Our contact tracings continue. Thank you to Lindsay. It's been a lot of work here recently with our recent uptick. I mean, we went from 4 to 18 in less than 2 weeks. We were still managed to stay green on the map. I believe that will change next week, because the end date for the data for the previous weeks was the 26th. So this next update will include last week when we had about 14 at our high. So I would anticipate dipping into the yellow and hopefully next week back up to green. But it is definitely a possibility that we dip into yellow for 2 weeks in a row, especially if these things continue. So again, the way to get ahead of that, wear our masks, wash your hands, watch our distances, and stay home if we're not feeling sick. I know you all heard about the phase 2 of phase 3, step 2 of phase 3 that opened. Would loosen some restrictions for some places. I encourage everyone to look at the actual regulations and instructions that are on the mass.gov guidance websites. And if you have any questions in interpreting that, call me and we will go through it together, and we'll do our best to answer those questions as we can. Also, making sure that we do our best to adhere to not only the letter, but the spirit of the guidance. So please give me a call. Also, please continue to call the office if anyone has complaints about people not wearing masks or things like that, because there are still fines in place. We can find a business and we can find people for not wearing masks in establishments. So in Abington, please just wear a mask.
Please and thank you.
Thank you. I don't really have any other specific COVID-19 updates unless anyone has any questions.
No, I presume the step 2 of phase 3, that's a rolling. So if we do become red, then we would roll back to step 1. Is that correct?
That's correct.
Okay.
And then and the board can make some decisions whether or not they want to maybe tighten restrictions or make other guidance specific to Abington if they want. I did forget to mention the schools. We've had the case that was associated with the school and the subsequent quarantines. So please, the school department, they're really, I'm working with them a lot. The nurses are awesome. The administrators, superintendents, assistant superintendent, everybody, the principals, they're doing the absolute best they can, and they're doing a good job. So that's a credit to this community. And I know not sending your kid to school is nerve-wracking, and also sending your kid to school can be nerve-wracking. So I please, one of the things that we can do is normalize the mask wearing while at school for our students, and normalize mask wearing when you're outside around the school grounds at athletic events, and making sure that even with our closest personal friends, that we're adhering to those 3 W's and staying home when we're not sick, or staying home when we're sick, only going out when we're not sick. Excuse me. And I think that's all I got for COVID-19.
I know there was some concern from people. I got a few emails after the cases broke out in the school. Just for clarification, if you were contacted through contact tracing, is that call coming from town hall or is that coming
Yes.
from the state?
So it might come from a private number if we are not in town hall when we're making the phone call. Sometimes it depends on where we're at. So Lindsay might have to call you, or I might have to call you from our cell phones. And if I don't know you, I will probably do the private ID. But if you're familiar with my name, I might just call you. If there's a chance you already have my cell phone number, which I think 90% of the town at this point does, you might get a call that says private. But like this last Saturday when we had to make some phone calls, we usually just go back to the office because that's also where we keep the records and do the paperwork. And for contact tracings for Abington, one of the things that is a point of pride for our office is that we do it all. Our contact tracers are in-house because, it's important for us that it is a member of our community that reaches out to you. Remember, I live in town. The nurse works in town, lives close by. Like we're all in our little sphere. So our office does all of our contact tracing, except for a few very specific instances where we can't. And like I said, the calls will come from us. It's not a contact tracer from the state. It is literally a town employee calling you.
And to the best of our knowledge, if you don't get called, then you're okay.
Right. Now, if there's a case that's outside of town where a person might be a contact of that case, the call from us might not be right away if we don't get it. The system update Maven doesn't get to us in a day or two, but usually it does. So there could be a delay if the positive case is from, no offense to like any of the other towns, but like it's there from Randolph, let's say, but they're a close contact of an Abington resident. We might not find out right away, but Randolph should call them, and in the event that they don't, when it hits Maven, we will call them.
Okay. Excellent. Any further discussion or questions on COVID-19 update? No. Okay. Moving on to our next item, flu clinic update. Had some good news about that today, right?
Well, I mean, it certainly wasn't bad news, right? Our phones were ringing off the hook. Thank you for everybody. Angela, thank you for answering those 900 phone calls that we got today. So we had a limited supply for children to get immunized, and we decided to do it in town hall on Wednesday afternoons because we know that that's when students are remote on every Wednesday afternoon. So we figured that was the best time to offer that. And we made all of our appointments, and we opened up some extra on the 7th and the 14th. So we have no more appointments for the 7th and the 14th. So we're looking at opening extra days. And we already opened Wednesday the 21st up for more appointments. We found out today, so I'm going to segue into adults and seniors and the rest of them, because the clinics on the following Wednesdays, Wednesday this week, Wednesday next week, and Wednesday the 21st are for kids only, ages 3 to 18. We found out today that there was a problem with our flu order from our current supplier of it, and that was canceled. Not only was it canceled, it was canceled 10 days ago, but they didn't let us know till today. So our supply chain got seriously disrupted. Needless to say, we were very upset. So we did a lot of scrounging around, and we think we found a supplier who will get it to us very soon. And we ordered 150 doses of that, and hopefully we'll have more adult vaccine, or we'll have some adult vaccine real soon. And one of the problems, and I know that's a broken record, is a lot of people are ordering more than they would have last year. But we're thinking maybe more in-house flu clinics, not just at one location. Like maybe pre-registration is going to be required because there's paperwork, but we can do it at town hall now. And we're still going to plan to have a senior one the third week of October, the week of the 14th. If we get our shipment in, and I'm hopeful that we will, but I was hopeful 2 weeks ago that we will too. So we'll wait and see. There's just the supply chain drama it's just out of our control. We've called everybody we know that makes it or sells it in the States. So hopefully we'll have some soon.
Yikes. And I guess we can remind people that although we're happy to do this service, if you're worried about getting the flu shot, pharmacies and doctors' offices do have them. That's why we're having trouble getting them. So Um, okay. Any questions or discussion on flu clinics? All right. Next item on our agenda is the hoarding task force discussion.
So we asked this to be on the agenda because we wanted to do. So hoarding task force has been on my radar for about 2 years now because of the pandemic and a lot of people being at home. I just feel like maybe it's a more apropos conversation because the people that normally are able to leave are stuck inside, and this is a task force of community members helping other community members to sort their stuff out. So we decided to call for volunteers. And Angela was kind enough to develop the flyer, the operation procedures, and the laundry list of things that we're going to ask you to get accomplished before you volunteer, before we'll call you to add you to the list of volunteers. And again, this is just members of our community helping members of our community by doing cleanouts, peer support, a friendly phone call maybe, or explaining to them why they don't need 47 copies of the 1983 Time magazine, which is a real thing that you might have to tell somebody. Angela, did I miss anything?
I don't think so. I mean, it's pretty much like you said, just people from the community helping others. Yeah, I'm not really seeing anything else that you missed.
Angela will be our point of contact for the hoarding task force.
Mm-hmm.
She'll be the one who will give you the Corey form, who will give you the Boston University training that we're going to ask everybody to do. And she'll be the point of contact for the standard operating procedures that we give to everybody that I believe I forwarded to the board before the meeting. I think this is it's one of those things that can help remove some of the stigma associated with hoarding. That it should make it okay for someone to call us and be like they need a little assistance, and it won't be a government entity. It won't be. It'll be a neighbor or a friend of a neighbor or somebody you know, which can really kind of like ease it in. And it might not be all done at once, but with support through time, you can help people, turn that around.
So if somebody is aware of, if they have a friend or relative or neighbor that they think may have a problem, should they be contacting the health department?
They should be contacting us to make sure that it's not a public health crisis or a public health problem. And we'll do what we can. Some of the legal areas of private property, and making sure that the fire lanes are open, it can get a little tough. Whereas I can't, kick a door in. A neighbor can knock on a door and say, hey, can we talk about this? I don't want to like make you feel uncomfortable, but let's have a discussion about this. Here, I made you a cup of coffee, something like that. But they should call us if they think it's a public health problem.
Okay, and then would the task force be, I don't know, let's say activated if a public health situation is reported to the health department?
Yes. And then we would go down the call down list and see if anybody's available to come help us out. Because a lot of these situations, a lot of them have built-in infrastructure to help the person out. Mm-hmm. Senior services, elder abuse, council on aging, the old colony elder services, the DDS, those kind of places that can help a lot of people out. But there's a lot of people that are just left to their own devices. We don't have infrastructure for. So the task force kind of fills that gap of providing infrastructure for those people who don't already have the means to get help. Mm-hmm. If that makes sense.
And hopefully intervene before something becomes a bigger problem.
That's the idea, yeah.
Okay. We had some concern from some citizens about government overreach, so I just wanted to make it clear what the intention and purpose of this.
No, this is actually, I'm trying to start this to prevent government overreach, so it can be community-based overreach.
Excellent. All right. Any questions or discussions on the hoarding task force? Okay, so the last item on our agenda was to talk to Matt Ronan of Skin Deep Tattoo, and he has not appeared. So I don't think I need a motion to table this. We'll just put it on the agenda for next week, for our next meeting. And other than that, I will entertain a motion to adjourn.
I'll make a motion to adjourn.
Okay. Do I have a second?
I'll second.
All in favor of adjourning, please say aye.
Aye.
Yeah, thank you. Thank you, Angela and Marty, for joining us. Thank you, Matt, for providing us with the feed. And everybody have a great night.
Wear a mask.
You too.
Everybody.
Mask.
Take away. Good luck on your hike, Marty.
Oh, thank you. I appreciate it.